This presentation will focus on the second stage of labor, from 10 centimeters dilated until the delivery of baby, and the third stage, after delivery of baby until delivery of the placenta. The second stage of labor begins when you are fully dilated, 10 centimeters, and ends with the delivery of the baby. The duration of pushing can vary from a few minutes to a few hours. There are many variables that affect pushing time, including if it's your first baby, method of pain relief, position and size of baby, etc. Contractions are 2 to 3 minutes apart, lasting 60 to 90 seconds, and are very powerful. You may have a strong urge to push. If not, your healthcare provider may suggest a rest period to allow baby to descend. You may try different positions for pushing to see what works for you. While pushing, you may feel tired, energized, frustrated, and excited. All of these feelings are very normal, including a need for direction, being overwhelmed, or even frightened. Your nurse and other members of the healthcare team are there to provide support and assistance. This diagram shows what is happening as you deliver your baby. After the head is delivered, the baby turns to one side, and the top shoulder is delivered before the bottom shoulder. The rest of the baby follows, along with the umbilical cord. When it comes time to deliver the baby, your healthcare provider will coach you through the last few pushes. Delayed cord clamping will be performed. After 60 to 90 seconds, your support person will be offered the opportunity to cut the umbilical cord. The baby will be placed on your chest for skin-to-skin contact. Video 5 further discusses postpartum care, and Video 6 discusses breastfeeding. Assisted vaginal delivery may occur in the following situations: prolonged second stage, concerns for baby's well-being, or maternal health conditions. A vacuum extraction involves placing a small plastic cup on the baby's head, held in place by suction. Your healthcare provider will apply gentle traction while you are pushing to assist the baby until the head is delivered. When the baby has not descended enough for a vacuum extraction, a forceps-assisted delivery may be offered. Forceps are two slim, curved instruments that are placed on either side of the baby's head. While you are pushing, your healthcare provider will gently assist the baby lower until the baby's head is delivered. You may be taken to the operating room for this type of delivery, and your support person is permitted to accompany you. Vacuum and forceps-assisted deliveries have possible complications for both mom and baby. You may see swelling, bruising, or lacerations on your baby's scalp where the vacuum or forceps were placed. Discomfort may occur when the healthcare provider is applying the vacuum or forceps. Vaginal tearing and soft tissue injury are possible with assisted delivery. Your healthcare provider will give you options to reduce discomfort in your recovery. Vaginal tearing can occur with delivery. Research has shown that small tears heal better than an episiotomy, which is a small incision made at the bottom of the vagina. For this reason, episiotomies are not routinely done, but may be performed if there is a risk of more severe tearing or the need to expedite delivery due to concerns regarding baby. Your healthcare provider will inspect any tearing to see if sutures are required. If you have not had an epidural, they will inject medication to freeze the area before they start to suture. These stitches are dissolvable, which means you do not have to have them removed. An ice pack and medication will be offered for discomfort. Cesarean birth is the medical term for the surgical delivery of your baby. In Canada, approximately 28% of women have a cesarean birth. There are many reasons why your healthcare provider may recommend a cesarean birth. It may be done as an emergency or booked in advance. An emergency cesarean may be recommended if the baby is in a sideways or breech position, the baby's heart rate is indicating distress, the mother has a medical emergency or is actively bleeding, labor has not progressed, the umbilical cord drops through the cervix ahead of the baby, or the uterus tears along a previous cesarean scar. Your healthcare provider may suggest booking a cesarean in advance. Some reasons for this include the baby's presentation, a history of previous uterine surgery, a known placenta previa, when the placenta is over the opening of the cervix, an active herpes outbreak, or an existing medical condition in mom or baby. Whatever the reason, your healthcare provider will answer any questions you might have. Before your cesarean birth, there are a few things that need to be done. Blood work will be obtained and sent to the lab. You will have an IV inserted and will be given antibiotics. A shave prep may be done to the area where the incision will be. A catheter will be inserted to keep your bladder empty. The physician will discuss with you the risks and benefits, and you will sign a consent form. In most cases, your support person may accompany you to the operating room. You will meet with the anesthetist, who will decide on the method of anesthesia. In most booked cesareans, you will have a spinal anesthetic. If you were laboring and have an epidural in place, the anesthetist will put more medication into your epidural to ensure that you are comfortable. If it's an emergency or there is another medical reason, your anesthetist may recommend a general anesthetic. This means that you would be put to sleep and your support person would not be able to be present. A blood pressure cuff, EKG leads, oxygen saturation monitor, and oxygen mask will be applied. Your blood pressure will be checked frequently. Your belly will be cleaned with an antiseptic to help prevent infection. A drape or sheet will be placed over your body and secured between you and the doctor to keep the area sterile. During delivery of baby, you will feel pressure at the top of your uterus. This is the physician pushing the baby down so that he or she can be delivered. After the baby is born is a great time to do skin-to-skin. During this time, the placenta is delivered and the uterus will be closed with dissolving stitches. The skin will be closed using sutures or staples. A dressing will be applied over the incision. You will be transferred to the recovery room where your vital signs, uterus, vaginal bleeding, and dressing will be checked frequently. During this time, you will hold your baby skin to skin and initiate feeding. The baby's admission exam will also be done. You will then be transferred to your room on the combined care unit. Many women who have had a previous cesarean are still able to deliver vaginally in future pregnancies. The third stage of labor ends with delivery of the placenta. For vaginal deliveries, an injection of Pitocin will be given with the delivery of the baby or after delivery of the placenta. This significantly decreases the amount of blood loss. You may feel a few mild cramps or contractions and an urge to push during the delivery of the placenta. This will occur while you are holding your baby skin to skin. Thank you for watching Horizon Health Network's video on delivery. We encourage you to view the next video, Postpartum Care.